Hi, it's Eric and welcome to our video conversation this week. Had a great week in Minnesota recently, visiting a lot of schools, touring a lot of companies, and holding several Congress on My Corner events, which are great opportunities for me to get your direct feedback. They're a lot like mini town hall meetings. Thank you for participating in those. In Washington, it's been a pretty busy week as well. We passed legislation commemorating the 100th anniversary of our national parks with a bill that I have that actually will mint a commemorative coin with all the proceeds, no cost to taxpayer, all the proceeds will be going to help our national parks as a part of that 100-year anniversary celebration, protecting some of our greatest crown jewels. We also passed several pieces of legislation on sex trafficking to combat sex trafficking in my committee, the Ways and Means Committee, as well in the Judiciary Committee. You'll be hearing more about those bills in the near future when we take them up on the House floor. Time to get into the questions though, and the first call actually came in from Erin this week in Mound. She says, Congressman Paulson, I'm very curious about your health care ideas. What is your vision for restructuring the Medicare payment program? How do you envision Minnesota can play a role in that? Can companies in Minnesota assist in restructuring or creating a new public program where the Medicare reimbursements are fair, timelier, more accurate, and more high quality? Thank you, Erin. Actually, it's a great question, Erin, and I am working on legislation to modernize the Medicare payment program, specifically around the area of chronic disease management, because Medicare today is very different than it was set up in 1965. Today, 68% of Medicare beneficiaries have 2 or more chronic conditions. That's consuming 93% of our costs. We have a proposal now, several of us on a bipartisan, bicameral basis, to modernize the payment system so we actually pay for results, not for just activity. Reward quality, not quantity. That means making sure we're going to reimburse our physicians for taking care of the patient over time, working with nurses, physicians, pharmacists across the board, and wellness programs to care for the patient. So it's health care, not sick care. I'm hoping it's going to lead to some broader discussion on actually saving a lot of health care dollars too. We also received got an email from Dave in Chaska who writes in, Dear Congressman Paulson, I was outraged to find out this week that the IRS had given bonuses to employees who have not paid their taxes. These same employees are responsible for making sure Americans follow the rules of the tax code, yet they're being rewarded for breaking it. Is there anything that Congress can do to prevent this? Dave, there's absolutely something we should be doing to prevent it. It's outrageous that it happened in the first time. There have been enough scandals at the IRS recently, as we all know, targeting individuals based on their personal beliefs. And then the revelation that millions of dollars of bonuses have been paid to IRS employees that haven't even paid their own taxes. We've introduced legislation, members of my committee, jointly this week, that will make sure that any individual federal employee that has not paid their own taxes is ineligible for bonuses, period. I want to thank all of you for taking the time to join in this week. Be sure to send in your thoughts, your ideas, and your questions on my website at paulson.house.gov, or of course you can reach me on Facebook and Twitter. Have a great week and a great weekend.